Hello again and welcome back to Viewpoints on the Line. To reintroduce our guests, Robert Metz is president of the Freedom Party of Ontario and Michael Shapcott is senior fellow with the Wellesley Institute. He is also a poverty advocate. Let's introduce our second subject matter. If we can just see the headline there. Online doctor's appointments being planned for Quebec. Quite an interesting point here. Online. In fact, here's how this system is actually working. It's going to be a chance for people to have a video conference session with the physician on hand. And it's being suggested that this is perhaps the solution to the crisis that we're having.
What I don't like about this is that it's taking it out of the public health care system. There's a private element, and I'm worried that anything that takes away from our public health care system is going to take us back to the bad old days, where if you're rich, you're healthy, and if you're poor, you get sick and you don't get help.
Yes, because there's a fee. There's a fee, as you rightfully said. Some $10 for a monthly fee to be part of this service, and $50 for each actual appointment you get by video conference.
So this whole thing is shrouded in this myth that we have in this country that we don't have private health care. Everything is private health care. What is not private is payers. Can't be private. And that's what the issue is. The issue is that we have a single payer system. And that's what is called, that's what they call the public health care system, which is nonsensical. It's got nothing to do with private service. All the services are private. Always have been, always will be, or they wouldn't exist. Simple as that. So the issue is who can pay. And when the government tells you, any government tells you as an individual you are not allowed to contract with a doctor, or he can't contract with you, one of you is a slave and the other one's a vassal. You just don't have any rights. I have a right to pay if I want to, even if I had OHIP. Let's say I could force OHIP to pay. What would be so morally wrong about me picking that $50 out of my own wallet and paying it? And yet the healthcare system would scream about that. That would be my crime.
And the reason why it would
prostitution.
Scream, and the reason why it would scream is because the minute we get into a two-tiered system, then the rich get the
two-tiered system. No tiers. Tiers is an imagination.
No. Tiers is exactly what we used to have in the good old days, back when the government didn't have the single-payer system, where rich people got to pay for their health care, and poor people did not get access to health care, and poor people died.
And now the middle class doesn't have access to health care either, because more and more of them are being pushed out into those waiting lists and going to the United States, going to India of all places, which is a hot place for really cheap and what would be expensive here. You can see it happening. And why should the government interfere? Why do you think that one person's right to pay for their health care deprives another person of their right? That's not even logical to me.
Well, so you're not suggesting to do away. You're not suggesting, for instance, when you look at this whole issue of private
Everybody thinks it's a fixed pie.
You're not looking at doing away with the whole system as we have it. You're just looking at an option to pay if you want.
Well, of course, we've always said you should be able to pay direct, you should be able to pay by private insurance, by public insurance, not taking away OHIP. You should be able to pay by charity, corporate research grants, but the one thing we insist on, the only place in the world, even amongst all the other, except for Korea, and what's the other one? I think Jamaica or someplace like that, where they ban private payment for medicine. It's just outrageous. And what does that do? It puts everybody into the same line, creates a longer line, creates fewer doctors who might not want to work in that system, and who's better off for it?
Well, I think if you want the other model, which is you got money, you pay, you look at the United States, where the government doesn't intervene.
Obviously,
what do you have
didn't
in the
hear
United
a word
States?
I just said. I just gave 5 methods of payment.
Listening to the two of
in the United
you,
States?
the capitalist and the poverty advocate.